Good evening and welcome to our COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights this hour. Today, Central Bank of Nigeria throws weight behind COVID-19 war to provide framework for grants, long-term facilities for researchers. On the International Nurses Day, we remember our health heroes and the task before them as the world grapples with a pandemic. And Russia now has the second highest number of confirmed infections after the US, with Putin's spokesman testing positive. It's been a difficult period for Nigerian health workers as well as others globally since the outbreak of the COVID-19 pandemic. As the world celebrates the International Nurses Day today, we'll be taking a look at the challenges facing health workers. Of course, many of them on the front line have been infected in the course of treating patients with the coronavirus. As at today, over 113 health workers have been quarantined after contracting COVID-19. The federal government has since spoken about insurance policies, extra allowances for health workers, but how much is being implemented across the country? On our theme, we take a closer look at occupational safety for health workers. In Nigeria, it's 4,641 confirmed cases of COVID-19 following recent figures by the Nigeria Center for Disease Control, NCDC, with 150 deaths and 902 patients discharged. A breakdown of the cases by region shows that the highest figure in the country from the southwest has 1,933, that's Lagos, followed by Kano in the northwest with 666 cases. The FCT in the north central comes next with 359 cases, and Borno in the northeast with 186 cases. Edo State has the highest cases still in the south-south with 79, while Enugu leads in the southeast with 10 confirmed cases. The Presidential Task Force has again asked Nigerian workers to ensure work safety at this period of COVID-19. The Secretary to the Government of the Federation at today's briefing asked Nigerians not to ignore the constant appeal by the federal government for them to maintain safety guidelines.
You will recall that the guidelines on the reopening of offices directed the management of such offices to take certain steps and put in place policies that would ensure the safety of their staff. Let me remind the leadership of various offices to make sure provisions are made for the following: infrared temperature guns at entrances, sanitizers, hand washing facilities, social distancing arrangements, and ensuring that masks are worn always. This is particularly critical for government offices in high concentration areas such as the Federal Secretariat Complex. We similarly admonish individual staff to cultivate the habit of personal safety first before depending on the general provision.
The National Coordinator for the Presidential Task Force on COVID-19, Dr. Sani Aliyu, speaks about the Madagascar option, just as he alerts that Nigeria is witnessing a rise in COVID-19 cases as a result of interstate travels.
Directed by Mr. President, I want to state again that any medication coming into the country, whether it's a herbal cure or concoction or a proper drug, has to be subjected to the normal regulatory process. The Madagascar cure will be subjected to the normal process we expect within the legal frameworks and guidelines that we have, more importantly, to not only to establish the drug efficacy, but also the drug safety. So this drug will go through the normal expected process, which will be quite stringent before it can be administered to anybody. In terms of interstate travel, the PTF continues to see disturbing trends where vehicles are carrying large numbers of people across state borders. The movements of people across state lines is actually against the lockdown process. We urge the public to please refrain from interstate travel. Only travel that is essential or travel involving the conveyance of essential goods is allowed. Movement across state borders is fast-tracking the dissemination and spread of the COVID-19 pandemic across the country.
During the question and answer session, Dr. Osage Hanue, Minister of Health, revealed that one of the patients at the National Hospital, Ms. Susan Idoko, has refused to undergo a third test despite persuasions.
I called her on phone and persuaded her to just let them take the test. And she gave me the condition that first they must give her all her results from the past. Then she will agree just to take a specimen. Those of you who have done it here know how simple it is. And I gave the instruction. They took all her results, photocopied all of them, and gave them to her. But on the day of the test, when NCDC got there, she told them that she wanted the test to be taken by World Health Organization, and then that the test should not be done in Nigeria. They should send it to UK to go and do the test. So that seemed to be a very difficult order. So it's becoming a very odd drama. It was reported to me, so I called her again and I said, why have you changed the conditions? You said you wanted your results, you have your results. And she wrote a text to me saying I should consult her lawyer. She has taken a lawyer. So that was just yesterday, I think. So we're going to continue with the lawyer business. But it's only just to document that she's okay and to leave. But it seems to be a drama that is playing out there.
The Central Bank of Nigeria governor is developing a framework for grants and long-term facilities for researchers and science institutions for the development of vaccines to curb the COVID-19 pandemic. Mr. Godwin Emefiele, at an event organized by the Private Sector Coalition for COVID-19, CACOVID, this was during the donation of This Day Dome, an isolation center, by Chief Nduka Obiagbona, publisher of This Day newspapers. Governor Emefiele said that the intervention will help the nation fight the pandemic, which has taken a toll on the nation's economy.
In order to encourage greater research and development in Nigeria of drugs and vaccines that would help prevent the spread of this virus, the Central Bank of Nigeria is developing a framework under which grants and long-term facilities will be provided to researchers, science institutions, and biotechnology firms to develop Nigerians' homegrown vaccines. Needless to state that if we wait for foreign countries to develop their own vaccines, we will be the last in the queue to receive curative remedies for our teeming population. The CBN today challenges Nigerian scientists at home and abroad to go back to their laboratories and develop Nigerians' homegrown vaccines.
We are talking about physical distancing, social distancing, and we must break the
Following the number of nurses infected by COVID-19 in Lagos State at 20, the State Council of the National Association of Nigerian Nurses and Midwives have taken the Enlightenment Train to members of the public. This is part of the 2020 celebration of the International Nurses Week with the theme, A Voice to Lead, Nursing the World to Health. The nurses put their words to action, sharing face masks to Lagosians in the Ikeja area, advising them to keep practicing the measures to break the transmission trend of COVID-19. Our health workers at the front line of any outbreak response and as such are exposed to hazards that put them at risk of infection. These hazards include pathogen exposure, long working hours, psychological distress, stress, and many more. Well, joining us on ways to better protect the healthcare worker in the studio is Pharmacist Sam Ohuabunwa, is the President, Pharmaceutical Society of Nigeria. Thank you for joining us on the program.
Thank you, Melissa.
Okay. Tell us about the key considerations you think are necessary, especially for occupational safety for health workers in Nigeria in the middle of this pandemic.
I think the critical thing is to ensure that the health workers who provide services to the public are protected so that they do not get infected. Because if they get infected, then we'll reduce the manpower available, and that will also affect the ability to take care of those who are sick. And I think that's why everywhere in the world, a lot of focus is being put on the PPE, personal protective equipment for all health workers. And the critical thing is that it's also in short supply. We know the fight to get face or nose masks, the battle to get even the PPEs and all else that is required. But I think that it should remain a critical demand, and government should pay a lot more attention to it. And it's important to understand that the exposure starts at the primary level. As you well know, when a patient feels ill, he goes either to the primary health care center or to the pharmacy. In a community, and those are the first front line. Even before, as we've known, you can spread the disease without being symptomatic, and that's why everybody's wearing masks now to ensure that you never can tell. So I think we must make sure that from the front line people, from community pharmacies, from primary doctors, and the nurses, that each time they are properly kitted and have a suspicion that whoever they're talking to might be carrying the infection. Government cannot do less, and their focus, both by government and private employers, must be that all those who work in healthcare systems today, because the truth is that every healthcare system, private, public, has become frontline. So I mean, those who are even in the quarantine centers, isolation centers, may even be better positioned, because they say before somebody comes to quarantine isolation, you have a suspicion. But when you're in your pharmacy, when you are receiving a patient in a clinical setting, you may not know. So I think what it's called for now is everybody kit up as much as possible to suspect that the patient you're dealing with might have issues.
Just to quickly get your thoughts on finding a cure, do you see us getting a remedy that is natural and non-toxic? The talk is over town about the Madagascar option, and we've heard the World Health Organization at the virtual meeting today say that they must all go through clinical trials. How do you clinical try organics, our traditional herbs?
Well, that's the point we were making. The Pharmaceutical Society of Nigeria is making that point. I've made it over and over again. And that's why even when I was listening to what the CBN governor was speaking, it was good music. It was like a response to our need. Everything is tryable. But the point is that the conditions for trying a properly formulated, identified product must be different. And even WHO and NAFDAC appreciate that there are differences. However, most of the people who do herbal medicines, the producers, do not have the resources to pay or conduct these clinical trials that are being demanded. And our position is that government ought to use their resources to carry out those trials. Because the position today is, if you have a cure, if you claim you have something that works, come and go and prove it. That is okay if it's something that people can easily do. Our position is that there are a lot of work that has been done today in herbal formulations by pharmacists, pharmaceutical scientists, biological scientists, biochemists. They've done a lot of work. They have a lot of formulations. I'm sure you'll have read a few people who have made a pronouncement. My position is that government should get those people and say, if you say your product works, let's take it to test and test it. So I believe it's doable, but expecting individual producers to do them would not. Because the Madagascar you speak about was something that a state took responsibility to work on before they found that it could help their people. That's what we need to do.
All right, we appreciate your time, President, Pharmaceutical Society of Nigeria, Mr. Sam Ohuapumwa. Thank you for joining us on the program.
Thank you so much.
Still to come on our COVID-19 update, mysterious deaths unconnected to the virus, says Yobe State Governor. We have that story and more after the break. Let's bring you some of the efforts of state governments across the country on the steps to stopping the spread of COVID-19. We begin with the President of Senate, Ahmed Lawan, who has emphasized the need for security agencies to ensure a total enforcement of the federal government's ban on interstate travels to curtail the spread of the coronavirus disease. Mr. Lawan made the call sequel to the consideration of a motion on the need to enforce presidential order banning interstate movement, sponsored by Senator Ike Kwerimadu. He says there's so much breach, and it appears that the security agencies who are supposed to enforce this, in most cases, appear helpless. He says they need to sit up. And governors of the 36 states will be holding their 8th teleconference meeting since the outbreak of the COVID-19 pandemic. The teleconference is to review the situation in the various states in the country and find paths for a quick way out of the effects of the pandemic. The meeting is expected to take place tomorrow, Wednesday. The porous boundary routes across Plateau State is a source of concern to the government in spite of the border closure directives to curtail community spread of COVID-19. The governor, Simon Lalong, has embarked on a tour of major entry routes where he expressed displeasure in the compliance level, and he has cautioned security personnel not to compromise but ensure that violators are arrested and prosecuted accordingly. Another border, this headache, is the bridgehead border axis of Onitsha, Anambra State, following the uncontrollable surge of people from other states into Anambra. The governor, Willie Obiano, paid a surprise visit to the area, shocked at the level of human and vehicular traffic at the area, which leaves the state vulnerable to the infection. The governor, displeased with the development, has asked security agencies to step up their game in the area and enforce strict restriction. And 5 more patients with COVID-19 have been discharged after testing negative to the virus at the Ondo State Infectious Diseases Hospital in Akure. This puts the total number of cases treated and discharged in the state to 11. Now, according to the Yobe State Governor, Maimala Buni, the report of mysterious deaths across 5 local government councils of the state is not connected to the coronavirus. The Commissioner of Health, Vice Chairman of the COVID-19 in the state, Dr. Lawan Ghana, who briefed journalists on the verbal autopsy preliminary findings, says 471 deaths were recorded within the last 5 weeks. He adds that 57% of the deceased had underlying chronic illnesses, while chances of importation of COVID-19 was minimal, as only 4% had travel history. Well, joining us for more on ways we can curb the spread of COVID-19 is Dr. Peter Imoese. He is a molecular neuroscientist. He joins us on the program via Skype from the United Kingdom. Welcome to the program.
Nigerians.
And Dr. Ugonnaya Igwilo, a public health physician, joins us here in Lagos. Glad to have you.
Thank you.
All right, let's begin with you, Dr. Igwilo, and that is we're seeing interstate travels, and we're being told that this is the reason why our cases are increasing. From your professional angle, how can we stop interstate travels?
Okay, so so far we've seen that some of the security agencies are telling us they're feeling hopeless. Communities are, of course, complaining that some of their communities are being used as routes to, move around or move in between states. I think one important thing we could do is try to find out from either the security agencies or the communities that why is this happening? For example, the security agents, why do they feel hopeless? Are they trained? Are they aware that they have a legal backing to enforce these measures? Did they receive any form of training? Are there things that they think that might help them? Are there challenges they're having? Or would they feel comfortable if there's a supervisor or someone who would be there to even help them address some of these, issues that they're encountering at those borders? And of course, in terms of the communities, you'll be surprised that the communities sometimes have, solutions to some of these issues. They know where the roots are, they know where the problematic areas are, and they can actually be a good source of, information and data.
Okay, let's bring in Dr. Imoesi here. Doctor, how troubled is the scientific community, and this is as a result of the coronavirus, COVID-19?
So the science.
Oh dear, we appear to be having a terrible audio there. We'll probably try to get a hold of you, hoping that we can hear you a little bit more clearly. But let's come back to what you were saying about interstate travel. We're witnessing that people are still moving, and at some point, people are also being smuggled in, and we have states who are returning people back, sending them back. This is, also bringing in some human rights issues with regards to the way things are going. But can we rely on Nigerians to take responsibility for their health? Can we say that they know exactly what this virus is and how to prevent the spread?
Okay, so so far, at least, we know that we've done a form of bottom-up approach in terms of our community engagement. So we are aware that Nigerians now know what the coronavirus is. Now, the problem we might have would be in terms of existing misinformation, like, the barrage of false and conspiracy theories that exist. So that also already counteracts some of the information. So you might have some Nigerians not even believing that such exists. So they might even keep, flouting the rules and, just keep going across the borders. Now, the issue now is, okay, where do we draw the line between trying not to violate, ensure that, okay, people have that, freedom, you also want to make sure that you're not, abusing their human rights. So this is why, I don't know if you remember when Boss Mustafa was speaking earlier on, he was talking about, we have to just keep persuading them. And at the same time, it might come a time when we might have to disincentivize some of these trucks that are carrying, for example, yes, you have that access. We've really the access to move in between states to carry foods and, cattle. But when you start carrying people, first of all, you're diminishing the effects of the intervention being done in all states. You're creating more burden on the health workers. So, we should also be looking at, for example, when I mean disincentivizing is like, having to tax them. Because, that's what we do on a normal day for things like tobacco, where, things that can cause harm to, people. You can tax such things, and the tax can even now be put into, for example, the COVID fund. So if you're flouting the rules, you can, of course, you can tax them and say, okay, maybe that could be, a deterrent. I'm not sure, but that could work.
All right, I'm being told we have Dr. Imoesi back on, hoping that you can hear me now. I was just asking what you think about how troubled the scientific community is as a result of the coronavirus.
Thank you. I think the whole world is troubled, and also the science community is also troubled at the moment. And that's why we've got every single individual when it comes to scientific discovery is out there trying to make research, do testing as much as we can.
Tell us about what we're learning about the SARS-CoV-2, because there appears to be a lot of research, a lot of data, a lot of studies. How do we sift facts from fiction?
Basically, there's quite a number of peer-reviewed publications out there that basically describe the virus behavioral pattern. So I think when it comes to novelty, we've gone past that a little bit because we understand the structural mechanism of the virus. So basically, to fish out the facts from fictions, you just have to go by relevant publications from well-known journal houses. That's just the way to go about it, because you don't just depend on information out there that are just going around and all. So you need to look at papers published in reputable journals, and based on those papers, you could make your informed decision. And there are quite a number of papers out there at the moment.
Just to quickly get your thoughts about a small study we hear that was conducted in China that found SARS-CoV-2 RNA in the semen of young COVID-19 patients. Samples were taken from those who were acutely infected and those who were just recovering.
Yeah, for that particular study in China, I think there are a kind of issues we need to clarify about it, if it is transmissible via sex. So there's kind of a lot of issues when it comes to transmission of the virus, when it comes to the semen. Also, there are studies also that also clarify that you also have the RNA virus in feces, in human feces, despite the individuals test negative after a period of 4, 5, 6, or 7 days. However, there's no full confirmation if this level of RNA present in feces or in semen is highly transmissible to human when it comes to interaction or when it comes to feces you have when you go to the toilet and all. So they are kind of research that you need more validation to be able to ascertain that, yes, there could be possible transmission via semen, and also there could be possible transmission via the human feces. So it kind of varies here and there.
All right, we appreciate your time, Dr. Peter Emoese, molecular neuroscientist. Thank you for joining us. We know we'll be talking to you in the course of the weekend. Thank you as well, Dr. Gunnar Egwilo, public health physician. Thank you. Now, the number of coronavirus cases in Russia has increased 232,243, the second highest number of infections in the world, surpassing tallies in Spain and the UK. The US is in first place with over 1 million, actually 1,347,936. Now, from the NCDC, the 24th laboratory has been added to the National COVID-19 Laboratory Network. You can find the latest guide on their website. Of course, the center says no sharing of face masks and do not use used face masks. The World Health Organization has everything you need to know, and it said that everything you hear about COVID-19 is true. Saying not everything you hear is true. So a campaign is on countering misinformation on the virus in several countries. That's our program at this time. Join us again for another update at 9 p.m. I'm Millicent Walker. In the meantime, stay safe. Bye for now.